Good day and welcome to Ask the Doctor. I'm Ile Ogoni. Today on Ask the Doctor, we'll be looking at vaginal infection. But before I introduce my guest to you, before we talk about this topic, let's go on our health tips. I believe with this, you will be safe to introduce raw garlic to your child. Welcome back. Our guest today is no other person than Dr. Ayowole Shola. He is the medical director of Elolam Clinic and Maternity, Orunwuru, Delta State, Nigeria. Dr. Shola, you're welcome to the program.
Thank you very much.
And it's nice having you today.
Oh, it's a pleasure also.
Okay. If you notice our introduction, we'll
Yeah.
talk about vaginal infection can affect mother and cause serious consequences to our unborn child.
Yeah.
So before we talk more on it, let's know what is vaginal infection.
Yeah. First of all, before I answer your question, let me talk briefly about the vagina itself.
Okay.
Now, the vagina is a muscular tube lined with mucous membrane. The mucous membrane makes it very, very susceptible to bacteria. So the vaginal infection, like you asked me, like you asked me, a question you asked me, vaginal infection, simply means the invasion of the vagina by some harmful organisms such as Candida. It's a bacteria. You're telling the names of that Candida, the Trichomonas. Candida.
Is it like candidiasis?
Candida is you call it candidosis.
Okay, candidosis.
Yes.
Okay.
That is when it is inflamed. That is when it causes a complication.
Okay.
You know, the name is Candida.
Okay.
But when it causes inflammation in the body system, we call it candidosis.
Candidosis.
Yes.
Okay.
So like the Trichomonas, we have the syphilis, we have the Gardnerella, and so on and so forth. We have the protozoa, we have the syphilis. So, you know, the nature of the vagina, the urethra of women are very short. So that's why they are very susceptible to bacteria.
Okay.
Is
You
very
say they are
short.
prone to...
They are very susceptible to bacteria because the urethra of female is very short. So they can easily, you know, contact bacteria.
Okay.
They could be easily be infected by bacteria.
Okay.
Yeah.
Wow.
When trichomonas get into the vagina, it causes infection. And infection will lead to a lot of complications in the body.
Okay.
Yeah.
Are there types?
Yes.
So what are the types?
The type of infection it causes. Now, it can bring about...
What are the types of infection that can affect the vagina?
The vagina.
Yes.
One of the first type that can affect the vagina is what they call the Staphylococcus.
Wow.
The Staphylococcus can affect the vagina. Because when trichomonas, when it metamorphoses, it brings about the staph, which could affect the vagina. And also, we have the trichomonas. We also have the syphilis. It can affect the vagina. And what it does, it doesn't even end in the vagina, and it goes straight to the cervical os, which is the neck of the womb, and which could affect the womb seriously, and could bring about sterility. The woman becoming, you know, having difficulty to become pregnant.
Wow. Does it have an age? Can a child before the age of 10
Yes.
or like 5 years old?
That's a very good question. The younger you are, the less chances you have for your vagina to be infected. Because between the age of 13 and 30, your body system, your body cells shed very easily, very often. Now there is a bacteria that is useful in human body. We call it the lactobacillus bacteria. It's not harmful. The lactobacillus bacteria, when you are between the age of 13 and 30, it functions very well. It's very, very functional. So what the lactobacillus bacteria does in your private part, it's not harmful, it's useful. It produces another chemicals. We call it the lactic acid and the hydrogen peroxide. these two chemicals helps to kill any bacteria that invades the vagina. They kill. So between the age of 13 and 30, it is very hard for someone who is very young, to have infection, because this bacteria, these bacteria, this lactobacillus bacteria, they work with age.
Yeah.
So the younger you are, the less chances you have to be infected with bacteria. But the older you are, the more chances you have to be
older
infected.
ones are prone.
They are prone to infection.
Wow. So which of these bacteria are more dangerous to pregnancy? When a woman, which of them is?
The one that is most dangerous is syphilis.
Is it like staphylococcus?
No, syphilis is different from staph.
Is it like syphilis?
Syphilis, well, they are related. They are of the same compound of bacteria. But the one that is most dangerous to the you are talking about to pregnant women, or
yes, dangerous to their baby.
To the baby.
Yes.
Syphilis, herpes virus. I didn't mention herpes virus, syphilis, herpes virus, and Warts virus.
Wow.
Very, very dangerous. Herpes virus and Warts virus.
Can you throw more light on that Warts virus and syphilis?
Yes. The herpes virus is an organism that affects the cervix.
Okay.
Now, when a woman is infected with herpes virus before she got pregnant, if she have not gone for checkup, what it does, it causes damages to the baby, the growing baby. Damages, into the hearing, can damage the ear, and also the.
This herpes virus can it be gotten through sex?
Yes, it's sexually transmitted. It's sexually transmitted. That's why I will advise viewers out there, before you get pregnant, make sure you go for checkup. Probably even before you get married. Before you get married or before you get ready to get pregnant, you go for checkup. At least 1 year before you get pregnant, you go for thorough checkup to know whether you are infected with any of these bacteria. Like the herpes, the one that is most dangerous is the herpes virus, because it affects the baby seriously.
Is it common here?
Well, it's common. Herpes virus is very common.
And there is no sign for the person to know that.
No, it does not cause. It does not give. It doesn't give anyone. It doesn't give sign. It doesn't cause the patient sign. It has no symptoms.
Okay, no symptoms.
It doesn't cause the patient symptoms.
Wow.
No symptoms, except if it has caused a lot of damages in the body system before you begin to see the symptoms of herpes virus. It destroys. That's why I said what it does now. It affects the baby, because the herpes virus, they prefer staying in woman's cells. That's where they breed. That's where they grow. So it doesn't cause the patient any symptoms until the woman is pregnant. When woman is found that they grow on they grow on new cells. Baby forms in the womb between the age of the very day of conception to the 10th weeks of the pregnancy. That's when most organs are formed. Okay. And herpes virus, they prefer growing in new forming cells. That's why they don't cause the patient any symptoms. Okay. So as you are pregnant, they prefer growing in new forming cells. Okay. So as the cells are growing between the first day of conception to the 10th weeks of that pregnancy, they will be eating on the organs. They eat to tell on the brain, it's on the ear, causing deafness, causing blindness. So they prefer herpes virus and Warts virus. They prefer growing on new forming cells. Okay.
Before we talk more on that, because you said it's advisable before someone get married, you go for test.
For test.
Or when you're planning to get married, you are planning to get pregnant. Yes. It's good for you to undergo some tests. But we'll continue before we talk about the treatments. Let's go on a short break. More of this when we return.
presence of God is here now. The coast is clear. You don't even have to. Come rest your soul. The presence of God is. Come rest your soul. The presence of God is here now.
Welcome back. Please just join us. The program is Ask the Doctor. And ladies, please sit down and watch this program because it will help you a lot. And even the men can still sit down so that you give your spouse advice on how to care for her vagina. Doctor, before we went on break, you're talking of different types. So can a woman still get pregnant if she's experiencing such infection?
Yeah, it depends on the kind
Of
of infection.
Okay.
Like the herpes virus, they allow pregnancy.
Okay.
Like I told you, prefer herpes virus and what virus, they allow pregnancy.
Wow.
A woman infected with herpes virus can still get pregnant because the herpes virus prefer growing in new forming cells. So in other words, herpes virus, they don't prevent pregnancy. But staph, candida, trichomonas, bacterial, they prevent pregnancy.
Okay.
Herpes virus allows pregnancy because they feed on the babies growing organs.
Okay.
But staphylococcus, candida, trichomonas, bacterial, they prevent pregnancy.
Okay. Earlier you said herpes virus encourage pregnancy.
Yes, allows
but just that
pregnancy.
it deform the child.
It
What about
deforms
the other types? What dangers do they have to the mother and the child?
Yes, the other types.
Yes.
Now the other types, most the other types, they don't allow pregnancy. Most.
Okay.
If a woman is infected with staphylococcus, is infected with trichomonas, bacteria, is infected with candida or gardnerella bacteria, they prevent pregnancy. Any woman with carrying such bacteria, but what it does,
What we want to know is that what effect does
what
it
is
have
happening in the body
for
system?
the
Yes,
children,
yes.
for the child and the mother, as in when the woman is pregnant? Apart from, you said herpes virus will make the child be deformed.
Herpes virus allowed pregnancy.
Yes, allowed pregnant. You said it makes the child to be deformed.
Yes,
Just like
it-
causing blindness or the child
Deafness.
Yes. Okay, what
Deafness.
about the other virus? What harm do they have for the child and the mother?
Okay, just in case they allow the pregnancy.
Yes,
But most
yes.
of every 10 women that carries trichomonas, staphylococcus, what it does to them, it makes them to become sterile.
Wow.
Because what it does, it goes straight to it affects the cervix, and it affects cervix to the fallopian tube. So it eats around the lining of the fallopian tube, causing inflammation, and the inflammation will thereby cause blockage. And when the tubes are blocked, there is no way the woman can get pregnant.
Okay. Apart from this, is there any stage they go before doing the proper damage? Maybe stage 1, like some virus, they have different stage.
Yes.
So stage 2, patients will experience the symptom. So that stage, is there any stage for this virus?
Yes. Like the virus now, I told you, they don't cause the patient symptoms,
Okay.
but the bacteria like the syphilis, the trichomonas, the candida, they cause the patient symptoms. Now the stage, if the woman is having what we call often vaginal discharge and itching, she can go for treatment
Okay.
in the early stage, in the later stage of pregnancy, during pregnancy. That is if it allows it, but most bacteria will prevent pregnancy. They don't allow pregnancy at all because
So
they cause
don't-
damage to the fallopian tube.
Wow.
Yeah.
So does that lead to blockage of
Blockage of the fallopian tube, of course, it does. It does. And when the tubes are blocked, that's where babies are formed.
Yes.
No, that's where
Same
fertilizer
time-
takes place,
Yes.
and development takes place in the uterus.
Does
So-
infection affect a woman's ovulatory system?
Well, of course, it does. It can alter the menstrual flow. It alters the menstrual flow, making a woman to have. If a woman, that's one of the signs you know that woman have been infected with bacteria. If she have an irregular menstrual period, painful menarche or menstrual flow, you know that the woman have been affected.
Okay.
Have been infected.
A woman is not supposed to have a painful menstrual flow.
Yes. Now it depends. Now, if it normally some it's natural for them to have painful menstrual flow, some, but not all. Some. That if you have gone through tests and there is no, there's no infection, there's no bacteria detected in you, it's normal for you to have painful menstrual flow.
Doctor, let's go to treatment now because we've known different types.
Yeah.
So can a woman be treated while she's still pregnant?
Yes, a woman could be treated while she's pregnant, but the treatment should be after the first trimester.
Please come to the level in case
Okay,
you know.
Treatment should be after the first 3 months.
Oh, okay.
First 3 months, because during the first 3 months, cells multiplies very, very, very fast. So any drugs taken then could abort the baby.
Wow. But it not depends on the kind of drug the person is
Yes,
taking?
what we do, we advise people not to be on drugs except if prescribed by the doctor during the first 3 months of pregnancy, because that's when the baby is forming. And little things can trigger bleeding.
Wow. And that could be dangerous.
That could be dangerous. So you expect you go to a specialist. Then after the first 6 months.
Okay, first 6 months now.
And you can take some drugs.
Wow.
There are drugs we give, but not the first 3 months.
And that's why it's good to prevent before the
pregnancy. That's why I said
going
yes.
through those symptoms.
It could affect the baby.
You not expect the person to inch for 6 months.
You have to inch. If not, it will affect the baby. It can cause abortion.
Wow, and that's why it's good to avoid self-medication.
Very, very, it's dangerous.
Wow. Well, viewers, if you just joined us, the program is Ask the Doctor, and today we'll be looking at vaginal infection. Before we continue, let's go on our nutritional value segment. We'll be back.
Garlic was used at the beginning of recorded history and was found in Egyptian pyramids and ancient Greek temples. It was one of the earliest documented plants used by the human for the treatment of diseases and maintenance of health. Here are some of the other benefits one can enjoy from garlic. Apart from imparting flavor to food, it also has immense medicinal properties. It has a variety of potent sulfur-containing compounds, which are the reason for the characteristic pungent odor. Allicin, the vital compound in the pod, is known to have great antibacterial, antiviral, antifungal, antioxidant properties. That is why garlic is best when finely chopped, minced or poured for some time. Garlic is also a reliable source of selenium. Allicin, along with other compounds like hygiene, elaine, and others, also have a healing effect on your circulatory, digestive, and immunological system, and help in lowering blood pressure, detoxification, and healing. They help control bacterial, viral, fungal, yeast, and worm infection. Due to its innate compound, garlic can help keep both bacterial and viral infection at bay. Fresh garlic is thought to play a role in preventing food poisoning by killing bacteria like E. coli, Salmonella, and Enteritidis. Garlic is great when it comes to treating skin infection like ringworm in athlete foot due to its antibacterial and antiviral properties. The anti-clotting properties of hygiene found in garlic help in preventing the formation of blood clots in the body. While this fat is great for people with heart ailments and those prone to suffering from stroke and other clothing disorders, it may also increase the risk of bleeding after surgery. Allicin in garlic blocks the activities of angiotensin and helps in reducing blood pressure. With age, your authority tend to lose the ability to stretch, and garlic can help maintain their elasticity. It also helps protect the heart from damaging effects of free oxygen radicals. The sulfur-containing compounds of garlic also prevent our blood vessel from becoming blocked and slow the development of atherosclerosis. The anti-clotting properties of hygiene helps prevent the formation of clots inside your blood vessel. The allicin present in garlic helps moderately lower blood triglyceride and total cholesterol. Raw garlic juice may be used to immediately stop the itching due to rashes and bug bites. It protects against frequent colds and bouts of sore throat. Its antibacterial properties help in treating throat irritations.
Welcome back, and I hope you enjoyed that nutritional value segment. Just by eating garlic, a heavy metal in the body can be detoxified. Well, doctor, you made mention of first 3 months treatment.
Yes.
So how safe is that treatment?
And
What should be avoided?
during the first 3 months.
Yes.
Now, I will always say the first 3 months before a pregnant woman takes any drugs is to be prescribed by the doctor.
Wow.
And I always advise people to go for early antenatal. Very, very. So the doctor will tell you the things you should avoid. Like, it is dangerous now to take anything antibiotic during the first 3 months. Even during pregnancy, there are other drugs we use that will help keep the baby from infection, so that the baby will not be infected. There are vaccines we use, but not self-medication. You're going to take antibiotics and some drugs that's it's not prescribed to you by the doctor. It will affect the baby.
Okay. So avoid mothers losing their babies. So what are the preventive measures, and what is your advice to the public?
My advice to the public is, like I said, you need to go if you are being diagnosed to be infected during pregnancy. Early antenatal is very vitally important. Early antenatal. So because there are drugs the doctor will give to you, and there are drugs he will advise you not to take. There are drugs you take, there are drugs you don't take. So that's why early antenatal is so vitally important, because there are drugs you don't take during the first 3 months of pregnancy. So, and also there are some foods you need to avoid too.
Wow.
There are food like taking fruits. There are some fruits you don't take because some foods are infected with bacteria. You avoid fruits also. Some fruits, except if it is properly, washed, or even you put it in the refrigerator.
As in practice, as in a good hygiene.
Like these, yes. Like some of these, you have something like these, the apples and the pineapples. If it is not properly washed, there are bacteria. You don't buy it from all these vendors along the road. Most of them have been infected with bacteria, and when you take it, you will complicate the issue. If you're already infected, been infected before becoming pregnant, so you avoid some fruits, except it is properly washed. You do it, in a very hygienic condition. So, I will advise don't take fruits. Some fruits, but fruit is good for women, but make sure it's properly washed. It's in a hygienic condition, in a good, proper hygienic condition before you take the fruits, because it helps you to stool. If you're during pregnancy, you are supposed to be stooling daily. If you don't stool, you have problems. Constipation will give you some problems. Will give you, abdominal discomfort. Will give you, it makes you become stressful, to make you become restless when you don't stool. But when you stool regularly, it makes you to be lax. It makes you to be very, very agile. You are very, very smart. You are smart. You are agile, and also you are stress less free.
Okay. Yeah. Well, obviously you've heard a lot more about this topic. Well, you heard what doctor said, and it's good for us to go for proper medical checkup if we are planning to get pregnant, or before marriage, or before the pregnancy. And according to him, he said when you are infected with any of this kind of infection that he has mentioned, please avoid self-medication. Make sure you see your doctor and avoid antibiotics. You are not a doctor. You are not a doctor. So when you're sick, please see your doctor and register for antenatal on time. He said if you must eat fruit, because fruit is good for our health, doctor.
Yeah.
But if you must eat fruit, please wash it properly. Well, that's it on Ask the Doctor. Let's know what you think. Our numbers and email address are showing on your screen. Well, doctor, thank you very much for being there for us.
You're welcome. Thank you.
Well, for sponsorship and adverts, give us a call on that number on your screen. That is it on Ask the Doctor. Ask the Doctor will come your way. Same time, same station next week. I'm Ile Okwanemu saying Health is wealth. So take very good care of yourself and live a healthy life. Till I come your way next time. God bless you.